I go on to introducing Devrat, I'd want to thank Sonia ma'am for giving us, the old students, this platform where we can connect back with our school students. It gives us a great sense of connection that we feel with you, and it gives us a great sense of pride being a part of Bal Bharati family. And I'd also like to acknowledge the force behind this webinar series, this initiative, which is the Bal Bharati Public School Pitampura Old Student Association Committee, headed by Tanveer Singh, who's also there part of this webinar. He's the president. Parinay Jain, who's the vice president. Rishi Wadhwa, who's the general secretary, and Praful Chugh, who's the treasurer, and I also a part of the committee. Now, without wasting any more time, I'd like to straight get on to introducing our very illustrious alumni, Dr. Devrat Arya from batch 1996. Well, Dr. Devrat Arya is a very dynamic and a very illustrious, celebrated oncologist among the top in Delhi. In fact, he's MBBS, MD, GM. He's currently a principal consultant at Max Saket and Max Lajpat Nagar. He's also a primary investigator in a lot of clinical trials that happen in his field. He is a member of American Society of Clinical Oncology, European Society of Medical Oncology, and Indian Cooperative Oncology Network's Noida chapter. So he's one of those guys who we all feel so proud of. And he's quite down to earth and humble. Thank you, Devrat, for accepting our request and becoming a part of our series on the very first request call we made to you. We also have Dr. Shubham Sahani, who's AIMS undergraduate gold medalist and 7th rank in AIMS PG postgraduate course, currently pursuing internal medicines from AIMS. So we have two very well-known, reputed doctors with high credentials, and it gives us a great feeling to have them with us today. It also gives me a sense of personal pride in introducing Dr. Dev, because he and I were batchmates, and he was the head boy of our batch, and a favorite of all the teachers, I must say. All the teachers were very fond of Dr. Devrat Arya, who if he allows, I would also address him as Devrat now on.
Yeah, certainly.
So he is one of those guys who's been doing extremely good from the school times. So Devrat, how was your school days? How was school important to you and made you what you are? We'll just keep the session a little short for everyone to know, because we know your exams are there. So whatever we can compress it in the least is what we'll go about with. Over to you, Devrat. Devrat, you need to unmute yourself.
Yeah. So am I audible? Hopefully I am. Yeah. So thank you, Gunjan. Thank you, school teachers. I know a few of you have logged in. Thank you, Sonia ma'am. I think I can see Raman sir there as well. Thank you for the office bearers of the Old Students Association. I think it's with a lot of pride and honor that I participate in the meeting today. Without doubt, I can say that the school has gone a long way in making me who I am, and my identity is not just that of a medical oncologist. I think it's much more beyond that. So happy to be a part of today, and I think I have a presentation. So let me see how I can start sharing that with you. So today I'm going to take you through my journey in medical oncology, and that journey has been a long journey. The journey started in 1996 with my MBBS, and it went on till 2011 when I actually ended up with my DM degree. And honestly, I'm struggling to put my presentation up. Gunjan, do you have it on your computer by any chance?
No, I don't have it. You didn't mail it to me, Devrat. So
Okay.
either you mail it to me and I'll share it, or there is
There is
a
a present.
present now option on the lower panel where you'll have to do it from.
Yeah. Just give me 1 second. I think I'm struggling a little bit here. Gunjan, I have mailed it to you. If you will please check it. I think it's from Suprita Rajput.
Let
That's
me
the
just
email
check.
ID. Yeah.
Yeah, let me just check.
Yeah. So in the meantime, till we can have the presentation up, a lot of times the most common question that I've been asked is, how did you plan for a journey that was 15 years long? How did you start out in your MBBS in 1996, and how did you plan for a journey so long? Wasn't it tiring? How did you find the means? And my honest answer to that is, I really didn't plan for that long a journey. I think the journey happens as you walk on the road, and as you understand the science that you've entered, understand the profession that you've entered, and therefore some of the choices that you make are choices that are made on the way rather than choices that are made right at the outset. At the same time, when I'm faced with this question, I also get recall. I can also recall one of the most famous achievements that human beings made, and I go back to the speech that John F. Kennedy made in 1961, that was in the U.S. Congress. Uh, so, U.S. Congress, 1961 May, John F. Kennedy said that we are going to go to the moon. And in 1969, man landed on moon. And when you go into a little bit into the history of that, the US did not have a rocket to reach moon. The US had barely been able to send someone for a very short orbital flight. And the US was lagging behind Russia, or USSR as it was known then. But John F. Kennedy laid out a clear goal that we had to land on the moon. He laid out a clear timeline. He said we are going to land within the decade, that was in the 60s. And then he went on trying to find ways to achieve it. So he found the right people, he found the right funding, and he was totally committed to that. And I think that to me is one of the astonishing stories that we can take a lot of learning from whenever we are planning on achieving anything in our careers. The second question that I'm often asked is, are you really passionate about oncology? And the answer to it is a yes. And were you always passionate about oncology? And the answer to that is no, I wasn't passionate about oncology when I started out. And then the second question that follows the first one is that, we are generally told to do things which we are passionate about. So how is that you're doing oncology that you're actually not passionate about? And I think the passion principle has been overrated. I remember watching Steve Jobs' speech that he made in Stanford University, that was where he said that you should follow your dreams, which I totally agree with, that you should follow your passion. But when you look at Steve Jobs' history, he started Apple just to earn $1,500 in that summer. It was not his passion, but as he started that company, as he started developing interest in it, it became his passion. And I think that's the second important lesson that I take from one of those celebrated stories. Gunjan, I don't think we have the presentation yet.
I did not get the presentation from you, Devrat.
So, okay.
We can just take a minute, Devrat. I'll guide you if you want.
Yeah, I think, yes, I think that'll be nice.
Yeah, if you can see if you can just
Present
click
now?
on your screen. Yeah, present now. Just
Yeah.
choose when you choose your entire screen.
Okay.
and then just open your presentation. It will be there. Perfect, perfect, perfect. So
So
if you can just open your presentation on your screen now. Yeah, we can see that.
wow.
Yeah.
So is it on now? Great.
Yeah, it is.
Perfect.
Okay. Thankfully, that's a relief. So those are my disclaimers. I'm not a career counselor, and I think I'm still a student and will remain one for my life. So quickly, so passion. So things I was passionate about in school. I think I was very passionate about sport. I loved cricket. I love swimming. I played a lot with my friends. I was also passionate about public speaking, reading. But clearly, where is my career choice here? Clearly, if you follow the passion principle, maybe not so apparent. And I think that leads me to the conclusion that sometimes, as you choose a field and develop a proficiency in it, that's how you become passionate about it. And that's what I strongly feel, that you spend more time in a field, and that's how you develop passion. And as I said earlier, sometimes career are often a net sum choice of decision that you make over a period of time rather than it being a one-time decision. And I feel that's why that it's not just passion that you need, but also informed choices. And sometimes you need to set up clear goals. Obviously, you need to work hard. You have to have the right strategy. You need to focus. You have to have full commitment. And obviously, destiny and good luck also plays a role. Your teachers play a major role, and the teachers can really guide you, correct you, set the course right. And I think if you have teachers and mentors who wish well for you, then I think that's a major help for you. So coming to my story, and I'll start with this picture. And I know this is a grainy picture, and you'll probably see me on the top left corner, the lanky guy, the lanky dark guy. So that's me. That's the Balbharti Pitampura annual function 1995. As Gunjan said, I was the head boy, and I was a proud head boy. And my association with Balbharti started in 1991 when I joined in class 8. And I had a lovely time in school. Uh, uh, Compared to the previous one, it was a smaller school. There was a lot more attention paid to co-scholastic activities, as they're called now, sports, public speaking, art. I made some very good friends, and I got really good teachers. And I really feel
Devrit,
that school helped me a lot. Yeah,
Devrat, I'm sorry. I am right now here compelled to ask you a question. I do know you
yeah,
were a
yeah,
head
yeah,
boy,
sure.
but
Yeah.
if I remember correctly, you were being a head boy was not your first choice, because if I also remember correctly, you were caught bunking classes. You were caught. You also got a katora cut in the assembly with on one of those days. So you've had, I think, a lot of things which doesn't most of the head boys don't do. And you were also a principal for a day when you became the head boy on the Teachers' Day. So how was all that happened with you in the school? I mean, what was all your school days all about?
Yeah, so your school was a lot of fun, and we had our own share of mischief. And yes, you're right. I did bunk a class once, and probably more than a couple of times, and then was really brought to task for that. I think mischief is an important aspect of life, and I'm happy that I did my share. Yes, I did say no to being the head boy, because I think that was the time I had started to realize that I really needed to pay attention to my preparation for not only my board exams but also for my medical entrance tests as well. And I did realize that being the head boy was a serious job and deserved a lot of attention. And I was not sure if I had the time or if I had the ability to do it. Thankfully, my teachers guided me, and I was chosen to be one. And I think it's the leadership role that you're supposed to play, being the head boy, actually teaches you a lot. And I think I learned a lot there. Katora cut, yes. I think we all have a Katora cut now as well, thanks to the closure of saloons because the pandemic. But yes, we had the Katora cut. I was the one of the less famous guys to get it. I think there were a couple of people who were much more well known who got it.
Yeah,
But good school.
I would not want to mention them, but yes, I do know there were a lot of other more bigger names who got it. Okay, another thing, David, that I was wanting and very knowing that you were very clear that you wanted to get into the medical field, and you were also preparing through other coaching centers like Akash, if I remember correctly. So, how
Yeah.
relevant school and I mean, how firstly, how did you balance it, and the school academics, and how did you? I mean, what was? How did you create that cohesion between the two?
Yeah, so it was a little bit of a challenge because there was a huge demand on time, and the schedules were very different from both the places. But I think when I look back, any coaching center, be it Akash or any other institute that's that's there, I think they have a single-minded focus, and their single-minded focus is for you to be able to make through your entrance test. I think when you compare it with an institution like a school is a much more bigger, more rounded institution. A school feels responsible for the kind of individual that they are going to make out of you, the kind of personality you are going to acquire, the kind of values you are going to acquire. And I think in that perspective, a school beats a coaching institute any day when you're talking about how you're going to turn out. Uh, Coaching centers at best are able to tell you the right strategies to adopt while preparing for an entrance test.
Great. So you had most of your school time. You did. You worked hard. You were passionate, and if I won't hesitate in saying that you were from school days very dedicated, determined, and disciplined, which I think has got you to where you are. So school has made a huge contribution to making you your destination, or making you lead a successful journey. So yeah, moving forward as to how you went about
Yeah.
deciding your future then.
Yeah, so I think school helps you get over your weaknesses, and as you said, I got a lot more determined in the latter half of class 11 and class 12. I was probably not as determined in the first half of class 11 because I didn't know what I was going to do. And I think that was the time when we had some of our own role models from the previous batches who had cracked the exams, and they were kind of setting the trends in career choices. They were the role models that we were looking up to. And then I was beginning to have a perception of the kind of career that you could have being a doctor or being an engineer. And I think what helped me back then was visualization. So I tried to visualize myself as an artist, as an engineer, as a sports person, and I think the only thing I could really visualize myself was as a doctor. And I, while I tried to keep my choices broad by having mathematics, and I think this is the picture of some of my school friends. I think there's Priyank, Ashutosh, and Manish. So while I kept my choices broad and slightly open-ended, so that I could decide later if I had to, I think towards the latter half of class 11 and 12, I started. I knew that probably medical entrance was what I was aiming for, and that helped me a lot. I think there were some other goals also. So I wanted to score 90%, which back then was a big deal, scoring 90% aggregate in CBSE. And I know it was a little funny, but I also wanted to get through into the Delhi College of Engineering entrance, and thankfully I was able to crack all of that. The one that I have not listed is securing more than 90 marks in math, and I was very poor in math. And I think Raman sir is here, and Raman sir was our teacher for mathematics in class 12, and I think he really helped me a lot, and that's why I was able to score more than 90 in math in class 12 board. I think some of the subjects that we had applied biology. I liked that a lot, and I think that those are one of the things that helped me decide my career branch. And thankfully, I cracked the exams in the first go, and that's where I started the next phase of my journey, and that was my MBBS at Maulana Azad Medical College.
Oh,
So yeah,
sorry,
so
sorry.
this yeah. So this is the picture of my friends, and this is us in Goa in 2018. So we have now got our families, the kids are there, and I think I'm proud of this group. this group consists of plastic surgeon, endocrinologists, surgical oncologists, leading cardiac anesthetists and all. And I think all of us have been able to make something out of our careers in our years since MBBS. But MAMC was a shock, Gunjan. I went in high on my rank, and we used to boast about top 50, top 30 ranks in all Indias and CBSCs, and it was like going from domestic cricket to international cricket. Everybody in Maulana Azad was a super intelligent person. And that's when I realized that just securing a rank in an exam doesn't mean you are intelligent. Intelligence is a lot more than just securing a good rank. And this was tough competition. These people were really good, really intelligent people who had good comprehension, good skills. And that's where I started feeling like an average student. And while I knew I was already into MBBS, I was not sure by the end of my MBBS, the academic session that's 4.5 years long, as to what I'm going to do, how good I was. And that's when I started internship. And MBBS internship means that you have to spend some time in all clinical fields. So you spend some time in gynecology, obstetrics, general medicine, general surgery, fields like ENT, ophthal, and so on and so forth. And since I was not sure what I was going to do, I decided that instead of just focusing on my PG entrance, I'm going to really spend time in the hospital, trying to understand what working in a field meant. And while I initially had started to like pediatrics, once I did my pediatric posting and I then did my internal medicine posting, I realized that it was actually internal medicine that I really liked. Unfortunately, that was at the end of my internship. So I took a gap year, reflected more, and then appeared for my PG entrances and ended up getting a seat. Now, what I want to highlight here is the fact that I ended up spending some time thinking about what I wanted to do. And generally, in doctors and a lot of professions, there's a sort of a rat race. You want to get through quickly into your next step instead of waiting. And we had friends. I remember a couple of friends who picked up seats which they got in the first attempt, only to realize later on that they really didn't like it. And in fact, one of them was courageous enough, bold enough to finish off his first post-graduation and actually go back to studies and started post-graduation in the field of his choice. But then I think it's important at times to sit back and reflect as to what you really like and what you really want, and then jump into it rather than just rushing into it.
Yeah, Devrat, very well said that we all need to think back, take an informed decision basis what we like in life. Otherwise, every day becomes difficult for us, and there's no going back after that. So I think, yeah, very well said that we all need to step back when we face difficulties and see. Your career seems to be really happening and illustrious, and from day one you seem to be just going high. Have you also faced stress while you were traveling this journey, Devrat, or everything was like very smooth as it seems to come across through your presentation?
No, so I think MBBS was a little bit of a stress because you need to read up a lot, and the subjects are diversified. Clinical subjects are something you end up liking, but there are also non-clinical subjects like anatomy and biochemistry and preventive and social medicine, which may not, at least to the uninitiated eye, be very interesting. But then you cope up with it with the help of your seniors, friends, and hard work. I think for me, the first big challenge was my PG entrance, which I think I was able to overcome in a very short span of time. But I think the major life lessons that I got was in the next phase, which was in Surat. So I got through All India, and since my choice was only internal medicine, I ended up in Surat, which is a prominent city in Gujarat, and I reached there in 2003. Those were the first few years, first few months of a really truly independent life, because that's where I started living in a hostel. But I think Surat also brought with it some of the stark realities of a country which is as vast as ours is. So initially, I faced discrimination. I think they have a set pattern of thinking about the people who come from northern India. But when I look deeper into it, I realized that what this means is that you, as an individual who has come from a culture outside of the place that you've gotten into, you really need to understand the new culture that you're getting into, the values of people, the reason why they do things the way they do it, their lifestyles. And I think you have to make an attempt to integrate rather than trying to align them to how you've been doing things. So that discrimination gradually t- uh, ta- turned into integration, and I learned Gujarati, and I think that helped a lot. There were some challenges with my personal life as well. There were a lot of health issues, and one of my thesis work had me doing echocardiographies for patients who had lung disorders, and I had to do pulmonary function tests as well. And I think doing that thesis, I ended up contracting a really bad version of tuberculosis. I ended up having multi-drug resistant tuberculosis, and I think I was admitted in a hospital for a long period of time. I was absent from my resident duties as well, and I had to drop 6 months. I think that was the first time I really failed in my life, and that came as a shock as well. So there was a health shocker and there was a professional shocker as well. But I made some wonderful friends. I met a lot of well-wishers. I met amazing individuals, and one of them was my guide, Dr. Parizad Wadia, who helped me a lot. And in fact used to pack lunches and dinners for me when I was admitted in the hospital. So that was a journey I learnt a lot from. And these are some of my friends from Surat. So one of them is a leading physician in Medanta. The guy who's sitting in the middle is a director in Bill and Melinda Gates Foundation, and he runs the nutrition program for not only India but also Bangladesh and Nepal. And these are the friends who I made in Surat. These are some of the friends who I made in Surat. And I think Surat was a learning, learning experience for me. I came back in 2006.
Devrat,
Uh,
I think you gaining your strength back, both for your professional on your professional and personal front. I think that that's what a trait of a true warrior is, that you actually gather yourself after a failure. And I think coming from you who've achieved a lot in life, you also failed is really something that I mean, it's quite inspiring that you gathered your strength, how you went ahead, you never gave up on your passion, you never gave up, you were so focused, you never gave up on life, and how you fought back. I'm sure that would have been a very difficult fight that you must have had, but it must have made you way too stronger to help you take on life on in a more stronger way. So I think that's really great. I mean, one cannot give up while leading life in actual school life, professional life, qualifications aside. But what is inside you is what has also helped you a lot to reach where you are. I think that's really, really hats off to you.
yeah, Gunjan. So I think it's important when you're facing the lows of your life to actually reach out to people whom you can reach out to, whether it's your friends, it's your parents, it's your teachers. I think it's important to reach out, talk out, share your feelings, and more often than not, you realize that all of us have our shares of difficulties, our lows. And when I look back at that phase of my life, I think that's one of the most formative phases of my life, and a lot of personality traits that I've acquired now, resilience, determination. I think a lot of those personality traits actually, those were formed in that phase, those 2 3 years that I spent, which I really don't refer to lows anymore. I think those were the learning phase and the most important phases of my life. Thankfully, they got over. So I got back to Delhi in 2006. I was tired from physically, mentally, with the experiences, with the medication that was going on. And I came out thinking of pursuing a career in cardiology. And I'd admit that most of us who are trained in internal medicine or general medicine, our first love is cardiology. And I said, okay, let me give a break to my academics, in the sense that let me not straight away pursue a degree. Let me just try and get to know how it feels to be a cardiologist. What does it really entail? And I think that's where I call it that the miracle at Gangaram Hospital happened. So I applied to be a senior resident over there online, and I got selected. And initially, I liked the job. Within 3 months, I was offered a DNB, which is a super specialty course in cardiology, and it literally landed in my lap. And at that point of time, it felt that this was the good fortune that I deserved. I had too many lows, and I deserved some good fortune. It seemed to be like that. But then when I looked deeper into it, I started questioning. So Gangaram is a good institute, and I'm not naming names. And this is 15 years back. But I started taking a more critical look at the kind of training I would be able to receive, the kind of career this cardiology promised, the kind of stability I could have moving on after my super specialization. And I really wanted to be coming out of my DNB super specialty exam being excellent at what I did. And I had some doubts about that. And I think that's where I realized that a degree is much more than a few letters that you add after your name. So you really can't have a degree just because it's a degree. So MD or a DM may look good, but you have to come out of that degree excelling in what you do, being good at what you do. And that's why I feel a careful choice of an institution is important. It could be based on reputation. It could be based on ranking. I think exposure to the kind of work that you're going to be doing in the future, academics, hands-on training. And I guess this is applicable to all fields, not just medicine. Gunjan, you would agree. I think this is applicable to any field.
True. Yeah, I mean, your qualifications does get you a good start, but at the end of the day, what you make out of life is purely your personality, your mental strength, your capabilities at the end of the day. But this also actually makes me ask you, what are the things that you think a good medical practitioner should have, or will make a personality traits also which you think a person should have to be in the field of medical?
So I think when you start being a doctor, you have to be prepared to be a student for life. The way medical profession is moving, and more so even oncology, and the way advances are happening, the way treatments are changing, I think you need to keep on learning new things. You need to be very patient, because you need to invest a lot, sacrifice a lot before you get your rewards, so to say. As an individual, you need to have a lot of sensitivity, a lot of empathy. Patients come to you in distress. They don't come to you because they're happy. They come to you because of some ailment. And when people are sick, that may not bring out the best in them, and you have to be sensitive to that. You have to be empathetic towards them. You have to be patient towards them. And I think broadly, those are some of the qualities that you need to have to be a doctor.
Oh, great. And how's your life as an oncologist now, Devrat?
Yeah, so
I mean, you're a reputed oncologist. You keep hopping between hospitals, taking OPDs, people calling you in advance, like 10 days, 15 days for your appointment. How is it all? How's life all now, from school to college to a thorough, hard-cut professional world?
Gunjan, if you allow me, I'll take that up a little bit later. I have a slide on that. But I'll go back to a question that I think I need to address: is why did I pick up medical oncology? After leaving cardiology, I was looking at the kind of field that I would want to get into, and the other obvious choices were nephrology and oncology. And in 2008, I cracked the exam, and I had both the option of doing a DM in nephrology as well as a DM in medical oncology. And I realized that oncology, even back then, it continues to be like that, but is a field that you really need doctors in. And back in 2008, there were just 12 recognized DM medical oncology seats all over India, right? right? And that's a very small number. And in terms of demand and supply, you really needed oncologists. I think one of the other key factor was the amount of money that I could expect, and money is important. We all have to accept that. By the time you start your career, you already have families and you have to take care of them. And to me, the package that I would be offered was also a factor. I love medicine, and oncology allowed me the option to continue practicing a lot of medicine, because cancer patients have a lot of variety of ailments. You can have the spectrum of medical ailments that you need to treat. Bone marrow transplantation, which is a part of medical oncology, appeared very exciting and glamorous. And the work-life balance, at least from the outside, appeared better than other fields. And the institution that I was getting into, that was GCRI, Gujarat Cancer Research Institute, was actually the biggest cancer hospital back then, with 750 beds, good exposure. And this is back from 2009. These are all of the residents of that institute, third years, second years, and first years. And you can see me right at the back. And GCRI was a good institute, good exposure. And to me, GCRI seemed to be the right place to be doing a DM from. And that's how I picked up oncology. And that's another picture. And I think any super specialty branch, including oncology, gives you the option not to be a student, not just to be a student, but also to be a teacher. And we had teaching responsibilities as well. And this is me taking a class of MBBS students, who's trying to demonstrate how to do an abdominal examination on a patient. And this is one of the highs. Teaching is one of the highs. And this is me now. This is my department. So on the left are the medical and oncologists and hematologists employed by Max Saket, and on the right is the extended department, which includes the students, the dietitians, the administrators who work for medical oncology. So Kunjan, coming back to the question, and I think I'll skip these slides. Coming back to the question as to the kind of work that I do right now. So obviously it's a lot of work. Physically, it's a 9-to-5 job, but mentally and on phone, there are no limits. So the phone keeps on ringing, as it was during this presentation as well. Patients need a lot of help. You get a lot of patients from outstations who cannot immediately consult a local practitioner. So they need to call you to get help. So no limit to phone calls, but I spend 70% of my time for clinical works. That's OPDs, IPDs, daycares. Increasingly, I am spending a larger amount of time to multidisciplinary meetings. So these are meetings where your surgeon is going to sit with you, your radiation oncologist is going to sit with you. I'm also active in cancer awareness programs. Teaching is also a very important part of my day-to-day responsibilities. It also includes making academic presentations to my students, to my DNB students. I'm a co-guide to the super specialty DNB medical oncology course at Max Saket. Clinical trials and support group meetings, patient advocacy take up the rest of it.
You seem to be working 36 hours and 24 hours, Devrat. I mean, I don't know how you can manage so much in your day's work, but it seems a lot on your plate. And you're still taking out time for us. Thanks so much. Yeah.
Yeah.
But tell me one more thing, Devrat. I see a lot of kids now opting for going for basic MBBS and post graduation specializations in the field of medically. They prefer going abroad. So, what's your view on your medical academics?
Yeah. So,
in India was international. The medical practitioners in India versus international markets.
So I think when I'll break the question into two parts. The first aspect is the academics. How good is the training in India vis-a-vis the training in any other country, including the US or the UK. I think it's fair to say that in India we get a lot more exposure to a bigger variety of patients as compared to what you get in the US, and that's why nearly 80% of my batchmates from Maulana Azad are currently in the US, and they are doing very well. I think their training here has helped them a lot. The kind of work-life balance that is there in some of these countries is slightly different from what it is here. I think Work is a little bit more difficult here in India, broadly speaking. The amount of work that you have to put into your clinical practice is a lot more. Whereas you have a slightly better balance outside of India in terms of balancing your clinical work with your academic responsibilities, the amount of time you want to spend into your clinical trials, and so on and so forth. Having said that, I think I have no regrets having stayed back in India. I think my career is fairly rewarding here in India.
Great. We have also another doctor speaker with us, Devrat. If I'll try. I like to pull him also. Shubham, if you're there, can you come alive? Shubham. Hi, Shubham.
Hi.
He's the new block doctor, still pursuing his MD from AIMS, seventh rank holder. You've also got a great credentials to laud about. So, how has your, if you could just briefly touch upon, you've heard Debra talking about how difficult it is and how things are. So, Shubham, if you could also share your learnings in the medical, I mean, from school to medical, and the stresses, and how you see it happening for you now.
Yeah. Hello, everyone. Hi, Devrit sir, and hi, all the teachers at BBPS. It's a bit nostalgic to be like here and getting back in touch with school and all. I hope you can hear me clearly, everyone.
Yeah, yeah.
So I still remember myself as a Bal Bharatian wearing, a big blazer with all shorts and standing there in winters and waiting for the bus. And then, in the assemblies praying that, oh God, oh Lord, to thee I pray. And all I used to pray was maybe I should get an MBBS seat and, crack medical entrance. And all I wanted, become was a doctor. And I guess, that's what guided me to become a doctor and, get into whatever I am right now. And considering like my story, so basically I was in batch 2014, and in the same year I cleared the AIMS UG entrance, and I got into AIMS Rishikesh, and it was like the most beautiful time of my life. And as sir said that MBBS days and MBBS friends are like the best, that you can get. To all those budding doctors and budding people out there, I would say that if medicine is what you want to do and you have the passion to be, please go ahead and, like go for it. Because, and don't think that how long the journey would it be, because, as Christopher Columbus said that you can never cross the ocean if you never lose sight of the shore. So if you always keep on thinking that what might happen later on or what might be, you'll never be able to cross the ocean. And as sir said that he wanted to take up pediatrics, so post my MBBS, I also like wanted to take up pediatrics as a life option, career option. But then later on, somehow I drifted towards internal medicine as a career option. And I gave the AIMS PG entrance and got rank 7. And thankfully, the same year I cleared MBBS, I got through AIMS entrance and got through MD medicine at AIMS New Delhi. And I'm currently first semester over there. And till now, it has been a very exhaustive journey, as it might seem to be, and it really has been exhaustive. But it has been fun at the same time. Medicine surely is exhaustive and tiring, but all the good experiences that you have towards the end and every day that you feel, it's like exceptional. I also have personal interest in med oncology. So personally, like having in these 6 months seen many lymphoma patients and all, and diagnosing them and then referring them, getting them treated, and then getting photos of them getting all right and all well, it is very pleasing and happening. And the pleasure that you get and the kind of appreciation that you get from patients, especially at government medical colleges, they're very appreciative to the fact that you like made them treat almost for free. It's like unimaginable, and it's very satisfying, as Devrat sir might agree. So, yeah, it has been a great journey till now, and I love every part of it. I love coming back to Delhi and joining AIMS Delhi. It is a beautiful institute, and as sir said, that choice of institute is really important. So, all my friends, all my juniors out there, I would say that really you should never think about whether I should take a gap year, whether I should, give it another shot. because life is always has more to follow, and you should always like give it a next shot. If you couldn't get into your choice of institute this year, maybe you can take a gap year, and then maybe you can try getting into the best institute, because exposure is what matters in this field. And I'm really grateful to God that I got to AIMS entrance, and it's a beautiful institute with a lot of exposure, the best of the minds, the best of the faculty. So yeah, it has been a good experience till now. As far as my juniors are concerned, I would say that these 2 years, mostly I guess I would be joined by class 11th and class 12 students. I would say that these 2 years are really one of the most important years of your life as far as your as a step ladder to your career is concerned. If you like work hard during these years, as well as going as well said.
Shubham, I think we'll come back to you regarding how do we go about cracking NEET and preparing from 11th and 12th. But I thought we will also understand a bit more on the oncology aspect and how this aspect of medical what is the future of this medical aspect. So we'll come back and there would be apparently a lot of question answers coming to you on tips regarding NEET. So be ready with that. So in the meantime, I'll go back to Devrat, and Devrat, I mean, I've been comparing you to Shubham. You are a veteran now in this field. So what do you see, and how do you see the the future of oncology in India? Is it something worth pursuing for kids, and what are the various options for kids in oncology now?
Yeah, so Gunjan, I think oncology is a very diverse field. So it has various pillars. So you could be a medical oncologist like I am, who does chemotherapies, who does immunotherapies, hormone therapies, and I'm also trained in bone marrow transplants. You could be a pediatric medical oncologist where you just treat children. You could be a pure hemato-oncologist or a stem cell transplant specialist. You could be a radiation oncologist or a surgical oncologist who use radiation or surgery respectively to treat cancer patients. But there are a lot of allied fields evolving as well, which include molecular oncology, which is the buzzword, oncopathology, genetics, oncopsychology, translational research, basic science, and palliative care. Coming to the question is, what is the need? I think cancer is a huge problem in India. It is estimated that we have 1.8 million, so that's 18 lakh new cancer cases every year. I think if you talk about incidence, the incidence prevalence is actually thrice that, and to translate it into roughly figures that you can understand, probably 1 in 8 adult is gonna get this disease, and the awareness is increasing. As per the last research, there is a tremendous need for oncologists in India. At the last count, there were less than 2,000 for the entire country, and this is after 2011, when they actually increased the number of seats for all respective branches. So oncology has a tremendous potential. Radiation oncology is a postgraduate course, so you could do an MD or a DNB in radiation oncology. Obviously, for medical and surgical oncology, you need a super specialty course, so that could be a DM, DNB, or an MCH. It's actually a PhD equivalent course, and you'd need a post-graduation in some of the subjects like internal medicine or pediatrics or radiation surgery or ENT. And then you also have fellowships that you can pursue after your post-graduation in fields like molecular oncology, palliative care, and genetics. It's an exciting field, and it's a challenging field, because you have to be more so in oncology, be willing to learn new things. And this is an example I've put up here. So chronic myeloid leukemia is a form of a blood cancer. And the first time I picked up a book of internal medicine, and that was in 1998, the treatment of choice back then was a drug called interferon alpha. I started preparing for my PG entrance, bought a new book. Again, for internal medicine, the drug of choice now was imatinib. And now when I actually practice oncology and I actually treat patients, the drugs which we're actually using are drugs like dasatinib, nilotinib, bosutinib, ponatinib, and you already have 4 or 5 new tinibs. So you have to keep on learning new things. The other thing which happens is that the state of the art gets applied in oncology very well. So some of you would have heard about the Human Genome Project. It started in 1990 and finished in 2003. So they're trying to sequence the human genome, the human DNA. And Gunjan, as early as 2017, 2018, we are actually doing the next generation sequencing, which is a DNA sequencing for our cancer patients in our clinics.
Oh,
So
wow.
bench to bedside happens very quickly, and you have to really upskill yourself, learn new things to be able to apply that, so that your patient who come to you get the very best. So that's about being up to it, and you need to be a team player, because for each patient you are going to be talking to a radiation oncologist, to a surgeon, to be able to decide the right treatment. You have to have good communication skills in medicine. Anyhow, the patients need to understand why you're doing something, how you're going to be doing something. And for any doctor, you need to have a lot of patience, and you have to have a lot of empathy. I think oncology is a very specific career choice. It's very exciting. It's right at the frontier of human biology. And I think, as Shubham said, you make a huge difference to not just patients. I think cancer is a disease of the entire family. One person suffers, the entire family suffers, and you make a difference to the families. Is financially rewarding, and it's still in demand, and probably will remain in demand for the next 15, 20 years till you have enough number of oncologists trained and able to practice.
Oh, great. Thanks, Devrat. Another thing that I actually wanted to clarify with you for the benefit of the kids was how important is it to choose a right college? As in, there are certain colleges which have high names, but there are and government colleges which have high names vis-a-vis, and it's not easy to crack them. I mean, for every one of us. So there are other good private colleges coming up. There are a lot of a lot of people do a lot of research. So how important is it to understanding, as in, is just the college like everyone, if I remember correctly from our days, all right, yeah, you've done MAMC, oh, you've got it going for the rest of the life? Is it like that in your field of oncology, or no, it is hands-on experience, it's your passion? Is it what all is it, just the college, or there's something more, and it's just purely for the kids to know कि अगर नहीं हुआ मैम से, never mind, there are other things? So what are the other options that we can also take in?
Yeah, so Gunjan, I had the same feeling that MAMC is the end of the world. But when I ventured out of Delhi, I went to Surat, and then I went to Ahmedabad. I realized the kind of good work those guys were doing over there. And therefore, I think while reputation is certainly the first thing that comes to mind when you're making your choice of the institution that you're going to get into, I think there are two or three other things that you really need to understand. A, you need to look at the academic program, how academically inclined they are, because even when you're doing your post-graduation or super specialty, you still have a lot of input from academics. You're still attending a lot of classes, you're making presentations. So academics need to be strong. You need to look at the kind of exposure that you're going to get. So, you can't learn medicine unless you see patients. And therefore, if you can get into an institution where the patient load is good enough, there is a varied spectrum of illnesses that the institute caters to. I think that for me is certainly a standout institution which you can opt into. And the third thing, and probably the slightly more difficult to judge, is the kind of mentors, the kind of teachers you are going to get in your institute. I think that's the biggest, the toughest thing to judge, because from the outside, it's very difficult to find out. And I think the one thing that helps is actually to talk to people who are actually working in that institute. So if you're going to get PG in a particular institute, I would suggest you talk to people who are already pursuing a post-graduation in that institute, and get their perception of how things are, and that sometimes helps you a lot. So I think name, yes; place, yes; but academics, exposure, and the kind of mentors you get, I think those are, to me, the important factors that help you decide.
So it is a combination of both that we need to have, which is a right mentor and a hands-on experience will always come to our aid, more than just having a tag of a good college, is what I can safely assume.
Absolutely, absolutely, and I think Shubham will also agree to it.
Yeah, Shubham, what is your thing on this? Also, please, just before Shubham also gives in his two bits, please start asking your questions, whatever you want from Devrat and Shubham, so that we can take it in the next 5-7 minutes. We'll start taking up the question answers then. Yeah, Shubham, over to you.
Yeah, yeah, it's absolutely true. The kind of exposure that you get is what matters the most. Because, I've seen a few very good institutes in Delhi. I would not like to name them. The very big names, but then people, the kind of exposure you end up getting over there, it's not that good. I would say whether be it private or be it government doesn't matter. The kind of exposure, the kind of mentors, like as I said, you get is what matters. Because ultimately you're going to be seeing patients. So if you're going to do maybe your MBBS or post graduation from an institute wherein you're not getting much quality patients, I guess that's not going to yield much of use. Also, the second thing is that any institute, it should not take a toll on your mental health. Be it any institute, if there are a lot of institutes, wherein there is a lot of work, people say that it's the best in the country, it's like that. But the kind of work that you have to do is so tiring, so exhausting that it takes a toll on your mental health. And I've seen people go through hell while they're doing post graduation through these institutes. So again, I would say like this should also be kept in mind. It should not have a toll on your mental health. You should not feel overburdened while you're there. And I can speak for AIMS. Well, it's not as light as you might take it. It's not as busy. It's like the right kind of exposure that you have. And sure, it becomes tiring at times, but you get adapted to it soon. It's not that tiring that it takes a toll on your mental health too. So, well, I can speak for AIMS, and that's it. So, if anything else that people would like to know specifically, then they might ask.
Devrat, how is it as an during this pandemic crisis that we are all going through? How is it actually affecting the medical fraternity, and how do you think it will go about changing the scope of medical fraternity or the approach of the medical fraternity?
I think that's a good question, and I was wondering when it's gonna crop up. So I think medical fraternity is a very broad fraternity, and so you have all sort of doctors, and I think individually it has affected us in different ways, right? So people who are right at the forefront, people who are chest specialists, general practitioners like internal medicine people, critical care guys, they are right at the forefront, and they, I think, are the guys who are helping us, helping the really sick patients tide over this crisis. Then there are people like us who are in fields which, although do take a little bit of a backseat, but really can't take a backseat because the cancer will not stop growing. And therefore, people like us, people in cardiology, people in nephrology, who are dealing with patients who have chronic disorders, we are trying to find a fine balance between aggressive treatment and treatment that does not pose a risk or additional risk for the patient to get corona. The third aspect is our own mental health aspect. Yes, it's a toll. Ever since the pandemic started happening, I'm sleeping in a different room. Earlier we used to walk in with our suits and ties. Now we have to change into gowns. We have to wear masks. We have to wear face shields. We have to wash our hands. And I think it's a new normal which is going to last for a fairly longish period of time. I think the pandemic, in a more philosophical way, Gunjan, and I'll take the liberty to be a little bit philosophical here. I think a lot of us have felt entitled कि सारी चीजें चलती रहेंगी. I think this is a rude jolt as to what real life can be. That you can't be entitled, you can't feel entitled towards things. I think it has forced us to slow down a little bit. The amount of time I spent with my wife and my kid in the past 2 months, I can't match. I have never been able to spend that much time. I've used this opportunity to read a few books as well. So in many ways it's a stress, but in many ways I've learned a few things and new things as well.
Oh, great. Devrat, we have a question for you from Sanvi, which says, so when you reached Mamsi, you realized that it was a whole big world out there. So how did you cope up with it?
Yeah, so if we have time, I'll just tell you a very short story. So there's a book called Gray's Anatomy, right? And that's the anatomy textbook that we read. And the first day of MAMC, in fact, not the first day, but the first week of MAMC, we had our first anatomy tutorial, and we had this student who was actually able to speak word to word right from page 1 to page 3, and it was verbatim. And I was astounded. I said, I can't match that. I am not someone who can mug that up. And so it was a shock. And you get grounded very quickly. You are on the high. All India ki bahut achhi rank hai, Delhi PG ki bahut achhi rank hai. You get grounded very quickly. But at the same time, you need to go back to your strengths. If you've been able to achieve that, it certainly is not a fluke. So you start working back on going back to the foundations. When you start something new, you have to learn new things. So you start going back to your books, start working hard, and you realize that while you may not be the best, you're quite good. And I think that's what I realized by the end of my MBBS, and certainly now that while some of us were the backbenchers, we did fairly well for ourselves when you look at our careers holistically.
Devrat, I do know that the format of the exam has changed, but I'm sure the basic way of preparation to crack exams, the entrance exams, would still be the same. What do you suggest are the handy tips or the handy tips you can give for to kids to crack these exams? And then we'll come to Shubham, who can give us the tips basis our current NEET format. So, Devrat, if you could tell us what did you do to crack these exams, is something that we'd be interested to know.
So, Gunjan, when I look back at the time when I gave my pre-medical test, that was quarter of a century ago. So, so if anybody is outdated, I certainly am. But the last entrance exam that I appeared for was in 2008 for my DM entrance examination. I think while I feel Shubham is much better placed to answer this question, I think broadly you have to have a strategy. You cannot just read books. You have to have a strategy as to what you are going to do. You have to have focus and commitment. And I think the times when you're preparing for anything, whatever be the entrance, be it medical, be it any entrance, you have to give 100% commitment, a full focus, which would mean that you're going to sacrifice a lot of other things that your colleagues, your friends may be doing. So it takes a lot of sacrifice. You need to keep on reflecting and reassessing your progress. So it cannot be the entrance exam telling you how good or how bad you are. You have to keep on testing yourself, and that's where your school tests come in. You keep on reassessing how good you are. You have to understand your strengths, but more importantly, you have to understand your weaknesses, and you have to work really hard on your weaknesses. But you never know what the format is going to be, what they're going to lay more stress on in the exam. So you cannot have weak points. So I think commitment, focus, continuous reassessment, I think those are some of the tips I can give. I'm sure Shubham will have a lot more to add to that.
Yeah, Shubham, if you could tell us how did you go about preparing for your NEET, and you cracked it so well. So please tell us about your experience on it.
Yeah, thank you. So basically, I remember that I started preparing when I was in class 11th. So it was like a whole new world. I was all into class 10th with that 10 CGPAs, and everyone was like romancing and enjoying. It's like we all have gotten into like 10 CGPA and now what to take. So I remember, like, again, as everyone thinks, like, okay, beta topper hai, it'll be like engineering or medical. So it'll be like bio to leni hai. Then comes the difficult choice aage kya le. So then I thought ki chalo number achhe, let's take math also. So it was like a whole new world and a very difficult world with physics, chemistry, maths and biology and a whole lot of subjects. But what made me different from others was that I think I joined my institute, that is Akash, quite early on. So it's like it's not what really does not matter is it does not matter which institute you join. What matters is that basically the institute shows you the right track, that how to go about things. So it's like the moment you are falling, the institute or your family or they pull you back to the right track. So that's the main role an institute plays. So basically, you have to remember that for any preparation, any entrance exam preparations, there are like 3 hours. So you have to read, revise, and then repeat. So it's like if you go through this cycle, it's you'll reach the pinnacle of success. So so people who are in 11 standards, buckle up and start preparing well for your entrances. There are three subjects basically that you need to master. It's physics, chemistry, and biology. You might take any other subject that you have, pay emphasis to that also. But again, these three should be your core hardcore subjects that you have to hit them right on. So, join a good institute, start making notes, whatever they are teaching, and try to read it, revise it, and then repeat the whole cycle again. At the same time, don't forget the importance of your formative years. 11th and 12th are your formative years. Don't pressurize yourself and push you, directly into the competitive world. कि मुझे तो यही करना है, and I don't want to go to school, and I don't want to prepare for anything else, and this is what I have to do, because that will make you a dumb person. So that's what made me different. Different. So I had many colleagues, who skipped school, joined an open school, just went about haywire, preparing for physics, chemistry, biology, leaving everything else, at the back of their mind, and they ended up faring very bad in the entrances, neither in the boards and nor in the entrances. So but I was consistent with my school performance also, and I guess I remember I had around 92% attendance in school. So you should never forget the importance of school, because the institute, whatever the institute might forget to tell you, you might accidentally end up catching that from school. And whatever the school might end up lacking, that you might catch it up from your institute. So it's like both of them are comprehensive, they will complement each other. So never forget the importance of school. Also never forget that 2 years down the line you'll be giving the board exams also. So you have to have a good grasp on your subjective concepts. Whatever is asked in the exam, you'll have subjects like English and physical ed and maths also, which might not be taught in your institute, because they're not important. So again, you should pay heed to these things also. The basic thing for any entrance remains the same, only that you have to remain consistent. If you there were people in my institute who were very hardworking in class 11th. They worked like anything. They studied so well, but in 12th they ended up becoming so overconfident about the preparation that the final result was very bad. So be consistent in class 12th also, and just keep it going, revise what you're reading, and I guess you'll sail through. That's it's like the simple mantra. So that's about it. So if any specific question, if
Thank you,
anyone
Shubham.
wants to ask.
Thank you, Shubham. Uh, Devrat, there are a couple of questions actually addressed to you. If you've seen in the chat, or if you want me to ask you here, there is a question from Yogita Rajput for you, Devrat.
Okay, so I
That
think,
what one should prioritize, school or the coaching institute, and how can a child get to know his temperament about pursuing science? It's difficult to accept that I am not meant for science.
Gunjan, I'm just going to intervene here. I just wanted
Sure,
to
ma'am.
tell you that Yogita is our biology teacher who teaches 11th and 12th.
Oh,
And Yogita is the one who actually suffers from this problem, because we have a lot of non-attending students due to the pressure of the tuition classes and so on, which is why that question comes up.
great. I think all the more relevant, Devrat, for you to address Yogita ma'am's
so I think this is a good question, and I think the way we
So-
look at it is slightly flawed. I don't think it's a pressure, so if I've opted to be both in a school and in a coaching institute, the right attitude is for me to draw the best from both the institutions rather than struggling with the two, right? So the idea is not to score marks there or score marks here. I think eventually I'm trying to place myself in the best position to achieve what I want to achieve, be it marks in the board exams or be it a good rank in entrance exam. So I try to get the best from both the institutes. So I think if one can learn a little bit of time management a little better and start prioritizing things, I think it's not difficult. It's not difficult. It obviously needs a little bit of practice, a little bit of time. But personally, I never felt the need to skip school. So I think my attendance, while it was not 100%, was fairly good. I think it was upwards of 90% in school. And I was fairly regular in my coaching class as well. There were times when you're struggling with exams at both the places and classes at both the places. But I personally felt that you're taking something out from both your school and from class. So I don't think there has to be a pressure. It's just about time management.
Yeah, I guess also school really helps for an overall grooming of the personality. And if you don't have that, Devrat, I don't think you can make it well in the actual professional world. And I think that applies to medical field as well. So
That's
prioritization is,
true. I would like to add something here. So basically, like as you said, that people feel pressurized. First of all, it should not be a pressure. School was like a moment of respite for me. Whenever it's like exhaustive 2 days, Saturday, Sunday of coaching and all, used to make me so frustrated and all. I knew was that there was a Monday to come and I had to go to school in the morning and I would meet all my friends. And apart from studies, there would be other things also. There'll be English classes in which you will relish upon the literature. There'll be PT classes in which you can play and all or gossip and all, whatever you want to do. So it's like, please don't be a dumb person. It should not take a toll on your mental health. I've seen people who like become so depressed studying, but it's like when you know that you have to go to school and meet your friends, it adds a cherry on the cake and it makes you happy or like, okay, I have a Monday to come and I'll meet all my friends. Okay, sure, next week will be tiring, but my friends will be there and it'll be all a good time. So yeah.
So we are running a bit behind time. So I'll take up the next question first, which is again asking Dr. Devrat, and the question is from Zanvi. What was the first time you felt the high of being a doctor?
So I have a very crisp answer to that. Lucknow 2006, my dad was having some atypical chest symptoms. 5 cardiologists had said that he doesn't need an angio. I forced one to do an angio. There was a block. He would have a what we call as a myocardial infarction or a heart attack on the train. I think that was day one that I felt really high. A few months later, the same happened with my grandma. And now I feel a high every other day. Whenever you are able to treat patient, heal patient, not necessarily cure, but treating and healing is also something that gives you a high.
And that high is addictive for sure.
Yes, that's addictive.
Great. Okay, so the next one is it not very hard work and very long journey to take when you choose medical field, and how you compare it with other fields? So if I understand the question correctly, is the medical journey to achieve the success a longer one as compared to other fields, and is it like a tougher journey as compared to other fields, popular fields?
So should I take that?
Yeah, please.
So Gunjan, I think for you to be the best in your field, you will need to devote time, and that's applicable to any field you're in. So that's irrespective whether that's medicine or law or chartered accountancy or journalism, you have to devote time, number one. Number two, I think it's important to enjoy the journey. And while my journey has been fairly long, I think I've enjoyed it on the way. So it's not been just work and no play along the way. I think there's been a lot of fun, a lot of friendships, a lot of really good times. I think as you travel, you want to do more, and that's how you end up doing more. So you never start planning for 15 years of training. It's just that you pick up your choices on the way, and you decide to devote more time.
There were a couple of more questions directed towards you. The first one again, first among them is, which aspects of your job do you find difficult and interesting both?
I think the most difficult aspect is treating young children with cancer. I think that can be very challenging at times. The other difficult aspect is treating patients with advanced cancers whom we cannot cure. I think that's the other difficult aspect. But I think increasingly with the advances in treatment, pediatric cancers are the cancers which have the highest cure rates, and we are looking at 70-80% cure rates in childhood cancers, and even in stage 4 cancers, we have a lot of patients who are living many years. But yes, that's very challenging. The exciting part is the new things that keep on coming up, and I'll just take an example of lung cancer. The way we treat lung cancer and the way we treated lung cancer in 2011 has actually changed twice over. So I've had to learn it and relearn it twice over. Now the way I treat lung cancer in 2020 is vastly different from how it was treated in 2011. I think that's exciting, challenging, but really rewarding. Really rewarding.
Okay. The next one is, so can a student who is studious but not very intelligent do good in this field?
Yes, absolutely. I think intelligence is one aspect. Being hardworking is another aspect. Strategy is the third aspect. And I always tell people, do not rate your own intelligence. Let somebody else do it. We always tend to overrate ourselves or underrate ourselves. So if you're not intelligent, it's not as if you can't be a doctor.
Shubham, do you have another point of view on this? I think Shubham's not. There's a connection issue with his. Okay, the other one, the last one. I hope there are no more questions after this. Is Devrat sir, what are the medical research fields which will be in demand in 8 to 10 years from now?
So I think the way research is moving and the way the government is waking up to medical research and medical trials in India, I think there's a lot of scopes, broadly speaking. When we talk about oncology, I think we have a lot of things happening for immunotherapy, target therapy, for precision medicine, that's tailoring a treatment as per patient's cancer's characteristic rather than a one-size fits all. Lot of scope in nanotechnology, a lot of scope in newer therapeutic areas, cancer vaccines, minimal access surgeries, robotics, telemedicine, to name a few. So I think this is a long list, and I've probably talked only about oncology. So if you want to get into research, the next 10 years are probably one of the most exciting times ahead.
Well, there are some more questions coming. So we'll try accommodating that.
We have Shubham is back now. So if you want to ask him.
Okay,
anything.
great, Shubham. Okay. Okay, the next couple of questions, there are more questions, and one is actually for Shubham. So let me start with this one. One is a field in which you won't have any time for any other hobby. All you have to do is study. How true is that?
If I got the question right, was it that we are all into studies and there are no other hobbies, is it?
Yeah, you can't pursue any other hobby while doing MBBS is what Sanvi wants to know. Is it true?
No,
are you
that's
guys boring?
not true. That's absolutely not true. I guess I've wasted a lot of time in my MBBS and a lot of other activities, which I guess I would have invested in the so-called good things, but I don't regret a single part of it. Be it school, be it college, or be it your post-graduation, you have to like have some other hobby which you can like lie back on, so that when you're frustrated and the day has been a really bad day and you've like had a really bad scolding from your seniors for doing something wrong, you should have something that would bring back a smile on your face, and that makes your day. So that's really not true. I've been into poetry in my MBBS days, and I'm really not into much of sports. but I like playing games, online games, and doing a lot of other stuff that you might call wasting time. For me, it's definitely not wasting time, and uh, you know it is really necessary to have some hobbies that you have, and it's really not true that MBBS will not give you time. MBBS surely, as Devrat sir would agree, will give you a lot of time to do many things that you would want to do. Of course, the first few years would be really hectic, and maybe the first year you'll not get much time to do things that you want to do, but later on it gets a lot much easier. You adapt to things and you get a lot of time to do things that you want to do. It's not really like that, and doctors are not merely puppets that keep on studying. You sure have to be a student all throughout your life, that's true, but yeah, you get a lot of fun to do other things. Don't worry about that. Come be a doctor and experience it.
Devrat, what do you have to say? Were you boring in your MBBS, or you could pursue a lot of other things besides study?
So Gunjan, I was a part of my batch team for cricket. So we used to play a lot of cricket in tournaments. I pursued dancing as a hobby and participated in the dancing competitions. There was a lot of public speaking. There was a lot of reading. So there was a lot of time, and even when you're in a busy curriculum, busy course, I think with time you get efficient, and you start finding time for your hobbies rather than it being the other way around.
Okay, so no more questions. They're just the last two questions we'll take. After this, no more, because we are close to 1.5 hours, and I'm getting reminders from Tanvi to wrap up as soon as possible. And Devrat has also got another few things to attend. So, Devrat, the question is that, in your opinion, on taking a drop after 12th to prepare for NEET, is it a good idea? Is what Ritvik asks.
I think absolutely. And a drop year, not just after 12, if needed after MBBS, if needed after your MD entrance. I think drop year, drop year is a very common thing in the West, right? It gives you a time to realize what you really want, reflect back on your choices, your goals, both professional and personal, and sometimes explore the field that you really want to get into. So if you want to get something really bad, even if you have to take a drop year, don't hesitate. I think when I look back at my life, I've taken a couple of drop years in my career. They hardly matter anymore. What's important is what I'm doing now, and is what I'm doing right now the thing that I wanted to do and the thing I like to do. If the answer to that is yes, drop year is absolutely justified.
Okay, so last question for the evening, which is for both of you. How do you rate private medical colleges over MBBS courses? How do you rate private medical colleges for MBBS courses? Now that you both have done your MBBS from government colleges, so how do you rate private colleges?
Okay, so that's a very subjective question, I guess, and as I already told. Hello.
Yeah.
Yeah, as I already told previously, that what matters is that an institute should offer you the right exposure. In my post graduation, I have a couple of batchmates who are from private medical colleges and doing really well. So it really does not matter where you do your undergraduation from, but what matters is how much effort you gave in that in those years. It's not that everyone from AIMS or everyone from MAMC or everyone from LHMC will get into great colleges in post graduation and do fairly well in life. It's not that everyone from private medical colleges are going to do very bad in life. Life is not always gray and white. There'll always be exceptions, and it depends on you if you want to be that exception or not. So I would not like to comment if a college is good or bad. What matters is you. If you are really passionate about medicine, and the college offers you the right amount of exposure to patients and all, you are good to go. I guess that summarizes it. If sir has to add something.
Devrat, you must be having a lot of people, your friends and your peer group who would have pursued MBBS from private colleges. So do you feel that they are lacking somewhere, or you have an edge over them? Is that somehow, is there a difference when you get into a professional space coming from a private college?
So I think I fully agree with Shubham. I think the question is not private versus government. The question is good versus bad, right? And you can have bad government colleges and you can have good private colleges. So I don't think, in my experience, the way my colleagues have turned out, there's any difference. If you are from a good college, be it private or government, you likely to do a little better. Obviously, your own hard work and focus and professional and personal aims are also important. So I think a good college is what you should be aiming for. I don't think private or government matters that much.
I think that's all for the evening then today. No more questions, please. I'd just like to thank Dr. Devrat Arya and Shubham for giving us such an insight into the medical field. And I think Tanveer also wants to say something. That's why he's getting he's pinging me. So Tanveer, yeah.
Yeah, thank you, Devrat. Thank you, Shubham. Thanks a lot for sharing this experience with the students. And it actually feels great today. Today's session has been actually one of the best in this season. That means the last few weeks we've been having the session. And so I hope students, everyone, you liked and you were able to get a lot of doubts cleared from these two alumni and your seniors. And I hope you've gained the most out of all these sessions that we've had for you. So we wish you all the best for your exams that are next week onwards. And if you feel like, we will be coming back with more career options and more inputs somewhere in July or August. But we'll leave you to that. Thank you, Gunjan, for holding the Q&A. Sonia ma'am, would you like to... is Sonia ma'am there?
Yes, Tanveer. Yes, Tanveer. I think it was a
Thank you, ma'am.
beautiful session. And you know what they say? Now, this is the winding up of our season one. And it's been, the season one's been beautiful. We had lots of illustrious alumni who came in, shared their experiences, spoke to the children. And I think that holds a lot of value, because when, you know, our own students speak to our present ones, they kind of hear, and it makes a much better impact than hearing all this from agencies outside, career counseling agencies outside. Now, as regards this one, I'd personally like to thank Dr. Devrat. Devrat, we are so proud of what you're doing. And Shubham, we wish you a beautiful future ahead of you, and I'm sure it's going to be, you know, teaching and the medical line. These are two beautiful professions where we impact lives. Now, we kind of impact lives in the way that we change them, and you impact them by saving them. So I think these are two beautiful professions where we are in direct contact with people, and we end up changing their lives. All my best wishes to both of you. May you have beautiful futures and lives ahead of you. Thank you so much.
Thank you, Sonia ma'am. Thank you, Devrat, for all your valuable time. Thank you, Shubham, for taking time away from your studies and helping our kids, current kids. Thank you.
Thank you all. Thank you very much.
Thank you.